Hello, my name's Dr. Cletter. Some of you might know me because I'm a GP at Oak Tree Surgery, and we're doing a video this afternoon on cough in children, and specifically we're going to think about coughs in kids under 5. Perhaps they've been coughing for a few days, maybe no longer than 4 or 5, and maybe they've got a fever as well, because it's a really common symptom in children. Most kids under 5 will have between 3 and 8 coughs and colds a year. And it's also a really common reason we see kids in the surgery, in emergency surgery. I might see 2/3 of it as children with coughs and colds and runny noses and things like that. And there's often a difficult decision to be made about whether or not they're really unwell or whether or not they're fine, and whether or not you need to bring them to the doctor in the first place. So I've got with me this afternoon Abby. Say hello, Abby.
Hiya.
I've always got my notes as well, which is why I keep looking at the table. And Abby has got 2 children. Abby, tell us about your kids.
Hey, I've got Olivia, a little girl who's 3, and Molly, a little girl who is 1.
Now, I'm guessing that Olivia and Molly have had coughs at some point or another.
Yes.
Partly because I asked you before we started filming this, and partly because I know them. So, what we're going to try and do is we're going to go through not the full lengthy guide of what you should do if your child has a cough, because there's plenty of that available online, and we're going to put some links to websites that are really good for telling you all the things you should worry about and all the things you shouldn't worry about in the description below, and hopefully at the end of the video as well. But what we're going to talk about today is some of the more subjective things, some of the things that you'll see mentioned in the guides as your child might have this if they're unwell, or your child might have this symptom if they need to see the doctor, but perhaps you don't know, well, they had it for a bit, or they had a little bit of that, and what should I worry about and what shouldn't I worry about? So, Abby, your kids, you've had plenty of coughs where they've been okay.
Yes.
And then you've had one cough in particular where you had to take one of your kids to PAU, to the Children's Assessment Unit.
Yes, that's right.
So tell us about that episode.
Okay, so when Olivia was about 20 months old, she had a cough. It was in December, so it was cold, it was winter. She had a cough for quite a few days. So I sort of sat on her, just watched her at home, gave her Calpol if she felt hot. I'd lost my thermometer at the time, so I didn't know she did feel hot, but I didn't actually have a thermometer at the time.
Right.
But she was okay in herself. She was still eating and drinking and chatting, but she was just a little bit quiet and subdued. But then when we woke up one morning, she came into bed with me, and there was just the way she was breathing worried me. She seemed like she was making a lot of effort to breathe, and it seemed quite fast, faster than it would normally be.
Okay.
So I phoned the GP surgery then as soon as it opened in the morning, and I don't know if I spoke to the duty doctor on the phone or whether I was just given an appointment with the duty doctor, but I came in and was seen probably within about half hour. It was really, really quick.
Okay.
And she sort of counted her breathing rate, and she sort of checked her heart rate, had a listen, and she could hear some crackles on her chest, but she was a bit concerned because of how fast she was breathing. Right. Which was, I think, what I must have sort of felt at home.
Good, so that's probably an important thing if we pause there, because a lot of the time when kids have a cough, they look awful when they're coughing, but in between episodes of coughing, the rate of their breathing and how hard they're working to breathe is normal. Yeah. And probably a good sign of that is that they're running around playing and things like that. And this episode was different because even when she wasn't coughing, she was having a bit of difficulty breathing.
Yeah. And actually, the first few days of it, she was exactly like that. She was still playing and running and normal in between the coughs. But that's what had changed on the day I came into the surgery, was that it was just that effort. Yeah,
okay, fair enough. And I suppose that also leads on to the other thing I wanted to mention, which is that when she was well, and at other times when they've had coughs, she's been, would you say, eating and drinking normally, or?
Yeah.
Yeah, okay.
Maybe eating a little bit less, but drinking,
Drinking, yeah. And that's an important thing to mention as well, because often when children have a fever, which is a common symptom that comes along with coughs, that doesn't necessarily tell us anything about how serious the cough is, but the commonest reason children become unwell with a fever is because they become dehydrated, because they're not drinking a lot and they're sweating because they're hot. Okay. And the other kind of bit you mentioned with that was her eating and drinking was okay, and also what we more formally call a level of consciousness, so how alert she was, how happy she was in herself. So she wasn't top notch, she wasn't great, she was poorly, but on the times when she was well, she was kind of happy to play and was awake and alert. What was she like when we had this episode when you had to take her to children's assessment?
So just needing a lot of sort of cuddles, didn't want to play, just wanted to sit on my lap and not move very much.
Okay.
She was still alert, but just not happy.
So more sleepy, would you say?
Yeah.
Yeah.
She was having, I think, an extra nap a day.
Okay, fair enough. All right. There's a couple of other things I thought we should mention as well, just because they're really common things parents bring their kids with. At any point, did you notice that the sound of her cough, how chesty it sounded, was different with the episode where you took her to the doctor and ultimately had to go to the hospital, or the times when they've been fine and you've not come to the doctor?
No, I didn't really notice the difference.
No, and I mean, that's borne out by the fact that lots of children can have coughs that sound really chesty. You hear people call it chesty or productive or mucky or fruity, is the expression I always use. And actually that doesn't tell you anything about whether or not it's more serious or not. It's more about how they look in themselves, isn't it? How happy they are playing around and what their breathing's like and things like that. And then I thought I'd also mention as well, cough medicine. Have you ever had any success with cough medicine? Have you ever given it to your kids and found it worked really well? Or have there been times when you didn't use it and they were absolutely fine?
I have tried it in the past myself and I never felt it was any good. I didn't even think to try it for Olivia.
Yeah, and what the literature says is that Calpol and ibuprofen are great for kids if they're uncomfortable or it makes them feel more comfortable if they've got temperature and it's bothering them, but cough medicine probably doesn't do much at all. And in fact, more recently, children under 6, there's been advice that we should avoid cough medicine in those kids. Okay, that's great. Well, thank you, Abby. I think we've covered the kind of the broad principles of when you should worry about a cough and when you shouldn't. The other thing to remember is if you're not sure, there's lots of advice available online. We'll put the links in the description below, but in particular websites like patient.info, NHS Choices, and also of course Penabon Health's website. And then of course if you've gone through all of that, and you've had a look at this video and you're still not sure, it might be worth going, giving the surgery a ring and speaking to one of the doctors, or if it's the weekend or the evening, give the GP out of hours service a ring. Okay, thank you very much.
Thank you.